Now, our participants were screened initially to ensure that they actually met the criteria so they could participate in this pilot study. And once they were actually recruited into the study, we conducted interviews at 1 week intervals. So at the end of 7 days, we would reassess their symptomology. Now, I'm going to provide you with a summary of this pilot study and the findings first, and I've also pulled out a mix of case studies to share with you as well. So as you can see, we had 9 female participants and 3 male participants in this study, and there is a reason for that, which I'm going to explain that in a little while. Now, when we initially screened our patients, we actually screened them for these symptoms that you can see listed on this slide, which in the literature are symptoms that are commonly associated with candida overgrowth. Now, as you can see, patients were given a Horopito preparation once a day with meals for a period of 4 weeks. And this is a summary of the results. We had 10 out of 12 patients who reported some improvements in general. We had 2 patients who had no improvements or changes to their initial symptomology. The most significant improvements first up and very early on were related to digestive and nervous system. In particular, we noted a fast initial reduction in brain fog, as was reported by some of our case studies. Now, we can't identify the actual mechanism for that through our work so far, but that is an area of research that we are still undertaking and looking into. So the improvements were noted for the digestive symptoms, as I said, so gastric pain and cramping and reduced discomfort after eating, they were very early symptomatic relief. We also had nervous system relief, so we had improvements in memory, reduction of brain fog, improvements in energy levels and sleep quality. We also had improvements to the immune system, so we're looking at a decrease in things like itchy skin and dermatitis, flare-ups, also post-nasal drip, and just a general reduction in that general malaise. Now, we're looking at the thrush symptomology. We noted improvements for things like discharge, irritation, and discomfort, so all those thrush symptoms. In particular, what we recorded was a very notable reduction in the number of episodes of thrush that patients were experiencing while they were on this treatment, the severity of their symptoms, and also the duration of thrush episodes that were occurring during this treatment period. Now, none of our patients reported any adverse events or side effects, and over 50% of our patients voluntarily chose to continue using Horopito after the study had finished. Now, you may have noticed that we also included men in this study, and we did that for a particular reason. And the reason is very simple. Candida is not selective. Candida is a natural part of the human body, and when it overgrows, it can affect anybody at any point in their lives. And it presents in different ways in different individuals. So when it comes to candida infection, you can have gastrointestinal symptoms, you can have genital symptoms, you can have general immune systems, and a great variety of symptoms when it comes to this infection. And what we've discovered is that men get thrush too. Now, there are particular circumstances under which this can happen, and I've highlighted that in one of our case studies.